Welcome to Black Health Matters. I'm your host, Darryl Armistead. This is a Howard University Hospital transplant support group session led by Dr. Clive Callender, who is a noted transplant surgeon and professor of surgery at Howard University College of Medicine. Let's join today's session in progress.
But is it more cases now than it has been years ago? I think we all know of someone who has Alzheimer's. We talk about it more often.
Any other comments? That's quite true. And
Yeah.
it's allegedly more common in women than men.
Mm.
But that may be because women live longer than men. But anyway.
From Armistead and
Well,
and from Armistead.
Any
could
other
be that
comments?
it could be that there's more Alzheimer's these days because in the 70s we got the double gifts of plastics and pesticides.
And the other forever chemicals as well. All of that. Yeah. Okay.
And also, due to other advances, we're living longer. And so maybe it's that, because some still Alzheimer's specifically as a dementia, but there is a school of thought that dementia is inevitable. You'd like it to occur at age 150 as opposed to 70 or 80 or 90. But, all of the risk factors of our environment and the impact of things that did not exist to the extent that it does now. We've talked about it a lot, the impact of depression and other mental health disorders and its impact overall on pushing our brains, our nervous system, accelerating things that we never were sensitive or knowledgeable about in the arena of hormones and how God has made us to respond to our environment.
Thank you for sharing. Any other comments? If not, we'll move to the...
There's another school of thought that says we're not actually living longer, it's that we're doing a better job of infant mortality. We go back 1,000 years ago, people that got out of their 30s had a good shot of getting to their 80s and 90s just like we do today, but we're doing a far better job with infant mortality. And longevity is actually now decreasing in the United States. Some other countries are holding their own very well, particularly Japan. But it used to be that diabetes was a senior disease. Now we've got young people with diabetes, and so with some chronic diseases, they're occurring at a younger age than they did before.
And you're saying that those children or those genetic codes are people who would have died in infancy.
Of learning and behavior. So when you think of a traditional school or a traditional psychologist, you might be thinking of...
Is there somebody who's talking? I can't hear you.
Someone needs to mute.
Okay. All right. Why don't we start with the articles? Thank you for a great discussion. Oh, this is an interesting article that is kind of interesting in that what it says is that type 3C diabetes is diabetes that's caused by pancreatitis and chronic pancreatitis, which is uh, separate from the diabetes that is caused by the insulin resistance and the type 1, which is caused by the lack of insulin itself. And type 3C then is one that is related to pancreatic diseases such as acute and chronic pancreatitis, in which the damage to the pancreatic cells is the cause of the diabetes, as well as they mentioned other causes, uh, cystic fibrosis, pancreatic hemochromatosis. So it's a kind of a uh, play on words, still diabetes, but it's diabetes that is caused by diseases of the pancreas. And it's something that we are not as commonly identifying, but it is occurring with pancreatic cancer and other pancreatic diseases. So they call this type 3C diabetes. Uh, and I don't know of any recent cases, but most of the diabetes is still type 1 and type 2. Type 3 is kind of a newborn in the block, but it's disease nonetheless. Dr. Perez?
I think they've been coining Alzheimer's, dementia associated with diabetes as type 3 diabetes.
Well, this is
Not
type 3C.
3C.
Yeah, it's type 3C.
And we were just talking about Alzheimer's.
Right, but this is a different entity. Okay, let's go to the next article. This is a kind of disturbing, good news and bad news at the same time. Heart attacks are declining, but deaths related to hypertension and arrhythmias are increasing. And it goes back to some of the comments that uh, Darryl was making relative to chronic diseases that obesity, diabetes, and hypertension more common than ever as we age. And these are now the leading causes of why people die from heart disease rather than the heart attacks, because we learned how to take better care of people who have coronary artery disease with bypass surgery and other stents and other things. But our success in managing obesity, which is 50% of Black women over 40 are obese, is still uh, far too high. And then, of course, the heart failure deaths, and hypertension, and is still rapidly increasing. So that, yeah. So the good news, yeah, we're not dying so much from heart attacks, but we're dying from chronic illnesses that hypertension and the arrhythmias, which of course is one of the leading causes of death. Uh, and remember last time we talked about the fact that arrhythmias, sometimes if you have a smartwatch, you can pick it up when nothing else does. Darryl, you got a comment?
Yeah, CVD deaths. I know strokes have to be a part of that, um, and congestive heart failure is increasing in the United States. So I'm just wondering, how does congestive heart failure, um, that's when the heart's not efficient, not producing enough oxygen?
Well, one of the main causes of congestive heart failure is hypertension and hypertensive cardiovascular disease. And uh, there are other causes of heart failure, but the commonest is hypertensive cardiovascular disease that causes the left heart to get enlarged and then to go into left side heart failure. And then, of course, there's the right heart failure, which is related to lung conditions. But what the heart failure deaths that they're talking about are usually related to hypertension.
Okay, I guess that was my question. So when you get heart failure that leads to death, that's not the heart attack myocardial infarction. Is that right?
No, it means no, it's not the. You can have heart failure from heart attack and myocardial failure, but you can have hypertension. You can have uh, heart failure from many causes, and the commonest is the hypertensive heart disease, in which the heart becomes enlarged and becomes inefficient. And as a consequence, you have a backup of fluids. You get pulmonary edema and fluid in the lungs, and that can take you out of here if it's not managed properly. So heart failure, but I think as we look at uh, obesity, hypertension, and diabetes, those all contribute to heart failure. So if we were able to better manage obesity, diabetes, and hypertension, we would have less heart failure and less cardiovascular deaths. So what they're emphasizing here is that the stent is only part of the treatment. The rest of the treatment is getting you to be more healthy, lose weight, get your blood pressure controlled and your diabetes controlled. And if you did all those three, that they are hoping that this would then uh, cause not only heart attacks to decline, but cardiovascular deaths to decline as well. Any other comments or questions about this article that puts us on notice that the chronic diseases that are so common, hypertension, obesity, and diabetes, that an ounce of prevention is worth a pound of cure here. Any other comments about this article? Okay, then we can go to the next article. That's Dr. Ferdinand, who's a leading cardiologist who recognizes that while there are food deserts, there's also deficiency of the number of cardiologists to take care of people who have heart problems. And uh, most rural areas don't have enough cardiologists, and so we need to have more people trained uh, to be able to deal with the heart failure that we just talked about. And a lot of this is really better control of hypertension and the diabetes, and to decrease the amount of obesity, which is ever increasing rather than decreasing. Uh, it's interesting that we're talking about increasing the need for another specialist when actually HHS is talking about decreasing the income for specialists, increasing the income for primary care doctors, which is an interesting idea, but it's counterproductive because the doctors who spend most time training are the specialists. But anyway, that's where we're moving. But the need for cardiologists is certainly not increasing. But the need is increasing, but the availability of cardiologists isn't. And that's what Ferdinand is trying to get more cardiologists to be available for people in the rural areas. The tough job that he has trying to make that happen. Any comments or questions about that? If not, we'll go to the next article. Now, this is an interesting article about lipoprotein A, which we've mentioned before. But as you see from this study, that only 0.4% of patients with arteriosclerotic heart disease have been tested for this lipoprotein, which is predictive for heart attack, stroke, and other cardiovascular causes. And so this article is aimed at trying to get more of the healthcare providers to get LPAs so we can get a diagnosis and treat increased cholesterol levels. We tend to get the cholesterol levels, the LDL and the HDL, but the LPA, which also is a way to identify a risk for heart disease, is something else that we should be getting as well. And this article is encouraging the healthcare providers to add this to the list of the cholesterol studies that we do. Darryl?
Can you request an LPA with your annual physical exam?
Yeah, you can request it. Yeah. Will your doctor do it? Yeah, probably. He probably just hasn't thought about it, but it's a good idea. Of course, if you're uh, as healthy as you are, you're probably going to be normal because of your good diet. But it's a good idea for all people over 40 to get it. And once you get it, one test is enough because it doesn't change much. John Buchanan?
Yes, Dr. Callender, is LPA a type of cholesterol?
Yes,
Oh, okay.
yes. There's a type of cholesterol that most physicians don't order because we used to get the LDL and the HDL, and the information we get from that is very good as well. But the LPA is another cholesterol level that is also identifies arteriosclerosis, which is hardening of the arteries. Yeah. Any other comment? If not, we'll go on to the next article. Well, we had mentioned earlier that HHS is uh, trying to cut the pay for specialists. And of course, cardiology is a specialty as well as surgery and other aspects of it. And this proposal is not looked upon favorably by any of the specialists, although the primary care doctors would benefit from it largely, and the specialists would be hurt from it largely. And they believing that this is counterproductive and goes against the way in which things should be done. But this is something that the Republican administration has been thinking about for some time because they feel that the AMA is too powerful and has lobbied for the specialists, and they want to reverse the impact of the AMA on medicine and specialties. Is this a good thing? It doesn't make sense to me, but I'm a specialist. So the primary care doctors may, on the other hand, say, well, we need to have some of that extra money as well. And I would agree. But taking it from one group to give to another is not necessarily the way to do it. Dr. Perez?
As a primary care doctor, yes, I think we should uh, be better compensated. But this is, the old strategy of divide and conquer. We want quality of care. And if you spend more time in training, it makes sense that you would expect that type of compensation. So I think it's a distraction from the lack of providing quality health care to everybody
Thank you for
and
sharing that
making it
perspective.
accessible.
What's that?
And making it accessible. There are ways and strategies and to make a specialty care available in rural areas. Compensation is one of them. If you have a will to do.
Any other comments about this interesting topic that I think is going to be thrust upon us by HHS, whether we like it or not?
It's unnecessary and it's a distraction. We have other priorities.
I think, as you said, the priority should be quality, but the, it, it is a distraction. But it's a desirable distraction for the current administration. Yeah. And of course, this specialties, you will see responses over time from all of the specialties. Cardiology is just one of the first, but all the other specialties will do the same thing. So this is just one procedure that will be dealt with, whereas uh, actually the entire specialty will be cut back. The internists, the pulmonologists, the surgeons, all of the suspects. This, however, is one procedure that, because of other complications, but this is just the beginning of what you're going to see over the next year. So, okay, let's go to the next article. This is an article that talks about some of the things that we talked about in the previous article, and that arrhythmia is hypertensive, heart disease, and obesity. All of those factors are part of why uh, heart disease is still killing people. And as we talked about, the an ounce of prevention is worth a pound of cure, and by losing weight, by having better care of diabetes and control of your blood pressure, this can occur. And this, of course, requires primary care physicians to emphasize that what we've talked about in the previous article, that while the declination of heart attacks, death rates from heart disease still are a problem. You might ask, why so many deaths from arrhythmias? And that's a good question. I don't know the answer to that, although this is the case for young as well as old. And that's why when we talked about last week, we talked about the smartwatches. Sometimes they can pick up the arrhythmias which you are totally unaware of because they can be asymptomatic uh, yet they can also kill you.
Mm.
So this article is an attempt to get the primary care doctors to be more concerned with chronic diseases, congestive heart failure, diabetes, obesity, and uncontrolled hypertension, because those are the conditions that are preventable and treatable. Diagnosing an arrhythmia becomes important, and that's many people may have arrhythmias and not be aware of them, and that's one of the things that those people who can afford the smartwatches can take advantage of it, that people who can't afford it will sometimes will just suddenly have an arrhythmia and not be aware of it and actually die. But uh, healthy lifestyle, increasing exercise, proper nutrition, and as we talked about, strength exercise as well can be very helpful in terms of promoting control of the blood pressure and control of the diabetes and control of the obesity. So it's a kind of requesting us to have the primary care doctors and the patient themselves to take better care of themselves and to ensure that all of the indices of good health are evident. Uh, and that, of course, causes us to be reminded that the center of the healthcare circle is the patient itself, patient him or herself, and that you really need to control what's going on in your healthcare and asking questions about your health and doing the right thing in terms of healthy lifestyles and healthy dieting. It becomes critical as going to the doctor. Any other comments about these provocative articles that are really asking the patient to become more a part of their own health care? John Buchanan?
Yes, it's kind of counterintuitive for someone who's got heart issues, um, especially if they're overweight. One of my very best friends passed away. I think he might have been 63 or 64, something like that. And we had been begging him to go back to the cardiologist. Um, but he didn't change his lifestyle. He loved to eat, and that was, I mean, he would eat and then eat some more. Uh, it got to the point where he couldn't walk for a half a block without having to stop and sit down. And so it there are a lot of issues that go along with this. I think uh, psychologically, uh, people who are overweight um, have that issue. Low self-esteem, that sort of thing, um,
No.
and just fear in general of going back to the cardiologist. But in retrospect, you know, it would have been so much better if he had done it. He would be alive right now. Thanks.
Well, thanks for sharing because uh, sometimes people, because they're overweight and they get short of breath after walking, think it's only related to the obesity, when in point of fact, it's related to the obesity and to the heart disease. And just as you mentioned, if he'd gone to his cardiologist, they might have been able to treat it because uh, coronary artery disease and heart failure can be treated. So, uh, but all of the factors you mentioned are operative in that situation. Any other comments or question?
I
Darryl,
also
Darryl first.
Yeah, my guitar player in November last year playing gigs, short of breath, overweight. Uh, he's blaming his shortness of breath on a cold that had been lingering for, he said, 6 weeks. Um, Loved to sing, didn't want to sing his songs, so I sang his songs. 2 weeks later, died of a heart attack in bed.
Mm.
Mm.
Wow. Sobering, sobering. Uh, was there someone else that had his hand up that I missed? No, it was Dr. Perez. Did you have?
I was
I
going to say we could have environments. I know we say patience, but I was so proud of my church. Um, a couple of weeks ago, we had workout where people came in their sweats, and we actually worked out in church for about 10 minutes. And I think when we have environments that make it easier for people, especially to get exercise, and it becomes, we can push it to it becoming the tipping point where more do it, where we encourage each other to communicate, to fellowship by a walk and not a meal, or different things. But I think if we have an environment that encourages and galvanizes and supports exercise, I think we can have a significant impact.
Right. And I think to add to that, if the churches would have more healthy food that they serve the members of the church when they have their affairs, that would also help. The question is, if you have an option of the healthy foods and the other foods, which will they take? But that's another area that the church can do. And I think it's great to hear that they have the exercise. The next thing would be to have the uh, options for healthy food as well. Darryl?
Yeah, exercise is great, but as far as losing weight, it's kind of overestimated. You eat a 2,000 calorie meal, say, okay, I'll burn this off. Yeah,
Yeah.
sure you will, but you got to work out hard for 2 hours. And you're not going to do that. So the most effective thing to lose weight is change your diet. But you
Yeah.
need exercise too to keep your heart strong.
Thank you for sharing and emphasizing those points. So important.
You
I'm
know,
glad.
there's another thing. When you exercise, you get hungry after you exercise, and you eat more, so you have to exercise more. You're exactly right. You have to adjust what you eat and be aware that after you exercise, you want to eat more.
The calendar is the number one killer, still heart disease, heart failure
Yes, heart disease. Yes,
is the number one.
yes. Still number one. Okay, let's go to the next article. Now, this is something that I've not read about before, and I thought it was interesting that probiotics can be helpful in treating cardiovascular issues because we tend not to think about the yogurt and things like that, probiotics. Uh, and but this article points out that probiotics can be helpful in lowering cholesterol and improving the bacterial count in your GI tract that helps decrease the cholesterol, and it identifies the those uh, probiotics that would be more helpful: yogurt, kefir, cheese, aged cheese they talk about, and sauerkraut, pickles, and other things that you see here. Um, this particular article kind of emphasizes the yogurt because it has protein and probiotics, but I think this is something that I don't too often see, where they recognize the importance of probiotics and having the right flora in your GI tract as being contributory to heart health. They also talk about those people who may not be able to do it as well because of they have weak immune systems. They talk about chemotherapy, transplant patients, and so forth, because uh, they may not be able to adjust. Uh, any comment about this interesting subject? Darryl Austin.
Yeah, of course, the most frequently mentioned probiotic is yogurt, which is dairy based for the most part. But a good alternative to that is kombucha, which is a fermented tea drink that you can get in most stores. And it tastes pretty good too.
Say that again. What's the name of it?
Kombuchas, Kombucha.
Oh, okay. Mm, okay. Thank you for sharing that. Any other comment? If not, let's go to the next article, please. This is an article that says that is a blood-based test that you can get that helps in the early diagnosis of Alzheimer's disease. While at this time we don't really have a good treatment for early Alzheimer's, um, it's something that as time goes on, as we get drugs for that, it may be more timely and important. Of course, the other advantages is you make an early diagnosis, you get the proper help for people who have early dementia that before it becomes destructive to the patient and the family. So this is something that is now becoming available. The only question for some is what is the benefit of finding out an early diagnosis of Alzheimer's when we don't have a treatment, but we do have ways of helping patients who have early Alzheimer's from being destructive to themselves and also being destructive to others. So, so that's the advantage of making an early diagnosis, although this test isn't a substitute for complete evaluation. And one of the things that is important for somebody who's suspected of having dementia is to early on get a neurological evaluation so that you can find out the extent or level to which the dementia is or isn't present. I think that becomes very important in terms of being helpful to patients as they uh, suffer from the different types of dementias.
And also, you can have help to families who have loved ones who have dementia.
Right. And that's one of the most critical aspects is uh, getting help to the families because uh, you wind up having uh, the helpers becoming patients themselves um, because the care of them can be very demanding. So thank you, Mr. Tatum, for bringing that up. Any other comments? If not, we'll go to the next article. Uh, ADHD is interesting because we're making that label often without recognizing that it is not really an illness. We talk about ADHD a lot, particularly in children, uh, but these children become adults as well, and it's not a mental illness, but it's something that you can be aware of to know how to help uh, younger people who take exams and other things. We have some of this in our medical schools where we have students who didn't know they had ADHD, and there are ways that they can take exams that neutralizes the distractions that they have when they have examinations. But it's probably about 1 to 5% of the medical class has an undiagnosed ADHD, undetected ADHD, which actually can be neutralized. They can take more time for examinations, have examination free of distraction, which can overcome some of the negative effects of ADHD. Any other comment about this interesting label that we give people? Which is to be distinguished from autism and other developmental conditions. I think in my generation, it was always missed. I never even thought of. In the generations of today, it's commonly thought of as a reason why students are distracted and is even medicated, uh, often successfully medicated. Any comments? I know you teachers have to deal with this. So, any comments from you?
You have to have sometimes a separate educational plan for these people. I say these people, I'm talking about the ones who claim to have had ADHD. They may have to be put into a faster lane in order to keep them a little bit busier than the other classmates.
Thank
Or in reverse, you need to have a plan to slow them down. Dr. Callender, you've mentioned that sometimes uh, they have tests where a student can have more time. So that would be the slow down method.
and to help them with these distractions. Dr. Perez, you had a comment?
I'm one of those people.
Oh,
And I was diagnosed by my daughter as a medical student. and then confirmed, of course, with a psychiatrist. But it's like cataract surgery. Whoa, that's why. It's the answer to so many questions, um, or or so many failures, not knowing the reason for a particular behavior. So it's very helpful to parents when the light comes on that many of the strategies that they used to address the behavior only made it worse. So, once the light is turned on, you can no longer curse the darkness. And what I have a personal commitment to is making sure that all that we know about a particular subject is given to everybody equitably. Because to know there are still, even though we are much better at it, there are children who are suffering. And without the Department of Education, I mean, that many of these programs, many of the requirements in order to receive federal funding was based upon your compliance with providing these children with the appropriate treatment. And Doge has wiped so much of that away. And to know something and to have the ability to address it and not do it is not who we are.
Thank you for sharing. Darryl, you had a comment?
Yeah, my comment is that we've always had jumping bean children. Now we have more, and I'm comparing our generation to current generation. And what I mean by that is when your brain is a jumping bean, you can't pay attention. And that's what attention deficit is. Um, there's a couple, the usual suspects, TV and sugar. Um, TV, okay, there's a big difference between TV and movies. And people that are in the film industry know this. But TV programming, you watch the screen changes. They call them camera angles. When it goes from one screen to the other, the average time is 3 to 4 seconds. Your mind can't concentrate on a 3 to 4 second schedule. But anyway, that's what screen time. If whether it's TV programming, TikTok, Instagram, you have kids' minds that are changing every 3 to 4 seconds. Compared to shooting a movie, it's you got to keep them more relaxed to keep their butts in the seats for an hour and a half to 2 hours. And so the screen changes from 7 to 8 seconds on the average, but not on TV. TV is short programming. You want the brains jumping around like jumping beans. And these days, processed foods, there's a whole lot more candy. We're in a Pop Tart generation for breakfast. So we give them a sugar rush before we send them off to school. You know, if I was king of the world, instead of medicating people with ADHD, I would change TV programming and eliminate sugar from the diets. And that way we wouldn't have jumping bean brain kids.
Thank you for sharing, Darryl. Any other comments? Probably many kids have had that in our generation, but just when overlooked. Yeah. But thank you for sharing those personal testaments. Okay. Next article, please. This is an interesting article. So we talk about seasonal affective disorder, but we talk about the gloomy days of winter, but never, I never really recognized that the same thing was true in the summer, during the late spring and summer months, that could be just as depressing. Uh, I wasn't aware of this, and so you need to be aware of it if you have children or grandchildren who, in the early summer, late spring, early summer, have this sad summer sad disease, which is they identify all of the signs and symptoms, which can be just as effective as seasonal affective disorder that we commonly talk about in the wintertime. I have not seen this myself, but uh, I'm sure that it's around. But if you're not aware of it, you probably wouldn't look for it. Any comments about this summer sad? Darryl?
Yeah, I personally think summer sad, or there's winter sad too. That comes from not getting dopamine release. Um, and you get that from exercise. If you spend summer not getting exercise, or the winter you tend to hibernate and not go outside, you don't get that dopamine release, you're going to be sad.
Mhm.
Thank you for sharing. Any other comments? They say almost exactly what you said, Darryl, in terms of how to cope with it. Any other comments about this interesting, uh, sad?
Well,
Okay.
the only thing I can say is spring and fall have to have their place too.
Okay. All right. Let's go to the next article then. Oh, this is important for treatment. SSRIs are important drugs that are used in the treatment of depression. And when you get pregnant and you're depressed, there was some concern about whether it's safe to use SRIs because of the effect on the child and the brain's development. And this FDA panel felt that it was risky to continue to take SSRIs during pregnancy because of the impact on the child. Uh, so then, what is a pregnant mother to do if they're depressed and the effective drugs that they take are SSRIs? That's the question that remains. As we know, postpartum syndrome, which can be devastating without treatment, is problematic. But actually, by that time, the child is gone, so you don't have to worry about it because you can use it after the delivery. Question is about using it when they're pregnant, and so anyway, the beat goes on, but this is a concern for your pregnant children and grandchildren who are in depression and are on SSRIs, and the impact it can have on their children that's in their bellies. And they're saying that we need to have better control studies to confirm uh, the safety or non-safety of the use of SSRIs in pregnancy and to know the impact of the drug on the children that are delivered under these drugs. Anyway, it's just food for thought for your children or grandchildren who are depressed and are taking medications during pregnancy. Dr. Perez?
And another pitch for how important it is for us to continue with research, not from pharmaceutical companies, but for other types of interventions, more holistic ones that generally have been funded by municipalities and philanthropic organizations that have been decimated by this administration.
But what are we to do?
We are to continue to discuss it, to make sure that everybody that we know votes, to make sure that those that need to be promoted, or not, I shouldn't say promoted, those who want to provide leadership in the arena of policy and practice, we need to support them. Um, we have to do what we've always done when we've been faced with this type of oppression.
Thank you for sharing, Jacobin. Oh, I'm sorry, no, that wasn't you. Any other? I think that's a very important comment. Any other comments? Okay, let's go to the next article. This was earlier we had a drug that was used for uh, post-traumatic stress disorder, which uh, is a problem that's becoming more and more prevalent. Uh, and this new drug, apparently was rejected uh, because of the data that did not support it. PTSD is a problem that I think is becoming more and more evident. Of course, our children of today that grow up in the midst of trauma, gunshot wounds, and those kinds of things, uh, it kind of marks them for the rest of their lives if they're not adequately treated. And so it's important that when we identify this as a problem, that we try to get the best medication that's available. There was one that was approved last month. Uh, and so we need to take time and actually see because we have so much of post-traumatic stress disorders uh, that affect our children and affect them from the time they're little and for the rest of their lives. And the treatments for successful treatments of this condition has not been good. So, of course, there are many ways of treating PTSD, including psychiatric uh, sessions. Uh, but as common as it is, the diagnosis and treatment becomes critical. Well, it's unfortunate this is not the case for this one, but it's kind of unfortunate. Do you see PTSD in any of your children or grandchildren? Was this something that is unknown to most of you? A lot of times we talk about it as it relates to veterans, not recognizing that it's our children that grow up in under traumatic circumstances are just as vulnerable as veterans. Dr. Perez, yeah.
I raised a young man for 9 years of his life, and and the trauma of his first year of life um, is still exhibited now that he is 19, almost 20.
Mm.
Chief of adolescent medicine at Brooklyn Hospital, I'd say 90% of my admissions were depressed from trauma. 90%
Frightening.
of the admissions were depressed and had aspects of post-traumatic stress disorder.
It's frightening.
Most of them. And then when I took a gig at maximum detention for adolescents, I was horrified that many of those children had been inpatient. Babies.
You finished, Dr. Perez?
Yes, and I guess I fear what is happening in the district. Just any kind of interaction with for our children with the criminal justice system has very severe consequences, and we are subjecting them to that now when there's no need for it. It's we will suffer the consequences of what's going on now for at least a generation, and we know it, and we're still allowing it to happen.
Thank you for sharing, Darryl. That's
I don't spend a lot of time on the south side of Chicago, but I spend enough time to know that the constant backdrop of noise, gunshots. Um, some are closer to where you are, some are further from where you are. The routine for children is you can join a gang, be out on the streets, or after school, you can spend the rest of your day inside. Not going out where it's unsafe. But all the kids in Chicago on the south side, they've got friends that got shot, killed. A lot of them have seen their friends killed. That's PTSD. There's a lot of trauma with the kids in Chicago.
Thank you for sharing. It's actually horrifying to think of what Dr. Perez shared with us and what you mentioned, because our people of our children of color, they are really victimized forever. Uh, any other comments as we face these crises?
Yes, I would like to say that uh, I noticed that my grandchildren seem to be pretty stable. I've been noticing them since they were little babies, but there was a neighborhood little boy that my grandson palled around with, and I know his grandmother. He lives with his grandmother. His father lives with in the house with his mother. So it's been a lot of turmoil in that family. Uh, I just kind of took him under my wings and loved him up and stuff because I could see he was missed shyness. He also was afraid to talk. And he got out of that as he grew older. And at the bus stop, I would meet up with him and his grandmother at the bus stop. And it seems that once he got in high school, he all that pinned up energy that he had um, came out of him, and he was more vocal and really thinking ugly thoughts and doing ugly things. Uh, and my grandson picked up on it and said, "I'm glad he doesn't go to my school," that type of thing. And then last month, I found out that he was put in jail because he shot someone.
Mm.
And the grandmother seemed to be nebulous. I tried to talk to her, but she kind of knew everything. She was one of those types that knew it. Yeah, yeah. Well, I've been watching him. He's all right though. He's all right. That type of thing. But I could see he was headed in the wrong direction. Um, when they went to high school, they separated. So uh, I didn't see him too much when he went to high school, but I did see him occasionally in going over to visit my daughter. But I heard about that uh, last week that he shot somebody and now he's in jail. Same age as my grandson.
Mm.
Yeah,
Sad story.
yeah.
Darryl.
Was that Darryl or Carol? Okay, well, I'll go. Yeah, we all know somebody or we've all got somebody in our family these days, usually, that's been in jail. And that's a huge source of PTSD just because the
Mm.
harsh environment, the violence, the isolation. Um, and so, they suffer while PTSD in jail, they get released. And just because of how it's whacked out their mind, they're going to have problems finding employment, keeping employment, forming relationships, and they get suicidal. It's all part of just a horrible cycle.
Yeah, well, boy, it's a horrifying situation that you have presented. And wow, uh, since behavioral treatment is so rare to find. Uh, it seems like those people are subject to PTSD for the rest of their lives. It's horrifying. Oh.
Dr. Callender,
I had my hand up.
Yes, go ahead, Carol.
I had two instances. One in 1922, my mother was relating an incident. She was from Helena, Arkansas, and they brought the people in the town out to watch a young black man who had looked at a white girl and burned him at the stake. Her mother told her to hide behind her dress so she wouldn't see it, but she peeked as any normal child would do, and saw the horrific, and which left images, she said, of white men who were extremely skinny and what they call the definition of redneck. So when she became a PTA president and a principal resembled one of the men that had burned the boy at the stake, she tried her best to fight that. But looking back at it now and us discussing trauma, trauma has happened to our people when they had to watch their people being burned at the stake or lynched in the South, or even discrimination. And then in 1989, John and I acquired children. And then I realized that one of the children had been abused sexually. And then I took the child to the pediatrician to see what we should do. The pediatrician said they'll be okay. Just bring this child to me when they're ready to talk about it. No other guidelines or anything. And I know that's way back in 1989. But when did the medical field start recognizing that trauma to children, especially after you acquire them, what you should do and should not? We're talking about it now. But if you come across this now, what are you to do with your children? Or you see an adult that has experienced trauma in their childhood? How can we be of help to them?
Well, it's clear that this is a serious problem for our children, and it does require professional mental health. And so psychiatry would be very important. And the sooner the better, and the more intensive the better. So that to me, that would be the first line of defense, is that get professional help for them, because PTSD is something, as you have mentioned, that is going to uh, cloud the rest of their lives. And if they don't get treatment for it, these so-called chronic diseases are bound to affect them in one way or another.
And
Uh,
we did take the children to, John was really the instigation of taking them to get help, mental help. But maybe we didn't get a professional because they said, well, if they won't open up to us or talk to us, we can't do anything, which I guess was true. But we ran into that brick wall of getting the children help.
well, I think that there's so many studies now that demonstrate that getting that early trauma and not having it treated uh, results in chronic diseases for the rest of their lives. So that it's imperative that they get mental health treatment, and that this uh, this would be mandatory to me, that they get mental health, professional mental health treatments. And of course, since the medication is not great for it, the personal treatment by a psychiatrist or psychologist becomes an important aspect of their health. There's no other way around it, really. Any other comment? Dr. Perez, you have any other thoughts?
I know it sounds like a chorus, but it is up to us right now. The insurance that we have made available to the children who most need it, it's being cut, drastically cut. You know, if you don't see yourself in redistricting and changing the house, and I mean things are really blowing up. We
Well,
had and I'm just saying, and I know you don't want to always tie the politics to the health, but they are so connected.
yeah,
We
but
had
that doesn't happen until 2026. That's what we do in 2025. It's not cut yet.
it's not, and it's important for us to advocate to make sure that it's not. We have got to make sure that we have the plan. They showed us 2025, Project 2025. We need to have things in place so that it's not an issue.
Well,
I'm scared about what we've talked about in terms of vaccines and children going back to school and the traumas that are occurring. We have children who are going back to school whose parents have
Stop
been
that
picked up
by
on
here
their
on your
way
way
to
home.
drop them off. I mean,
Are you
there's
going home?
trauma going on all over in our communities.
Yeah, stop by here on your way home.
I mean, that has got to be our discussion.
okay. Thank you for sharing. Any other comments?
Yeah, I like Dr. Perez's story about the boy that she raised, and also Jacobet's story. They have some similarities. Um, in Jacobet's case, here you have one grandchild that's, doing all right, and the grandmother is doing all right. And on the other side of the fence, you got a grandmother that is not keeping up with what her grandson is doing. And here he ends up in jail. And I'm sure that they both have raised their grandsons as best they can. It's just, Dr. Callender, that sometimes, you can have the best parenting and the best grandparenting, and still something happens.
Any other comments? Okay. Well, I think the one clear message is that PTSD is more common among us than we would imagine, and that it does require treatment as early as possible and as long as possible because it is a disease that will cripple you for the rest of your life. Okay. Let's go to the next article. And this is an interesting disease, autism. We talked about it last week as well. And trying to define autism is one of the most interesting aspects of this whole situation because they have four different manifestations of autism, and all of them identify a unique way in which the subject of this uh, developmental disorder manifests itself by the way in which they interact with people other than themselves. And uh, they emphasize that it is not a mental illness, but it's a developmental delay in the neurocognitive system, and that there's so many types of it that result in behavior that is non-traditional. And so that in terms of trying to interact with it, it requires a lot of individual attention to the particular person who has this autism. And they talk about it being related to genetic influences uh, and how that this is found in families that have a genetic predisposition to it. And also talks about the inability to interact with others other than themselves, and the repetitive ways in which they interact, uh, and there's no single way that they manifest itself. Uh, I don't know if any of you have children with autism, but it's primarily genetic and biologic lack of development in which the person really sticks to themselves and has the inability to interact with socially with others, uh, and requires working with the pediatrician and understanding what kind of development delays are evident. Uh, I don't know if any of you out there have had any children with autism, uh, but or adults with autism, because they present themselves in so many different ways. Any comment on this? Except that we don't know what causes it, other than genetic situations. That is, it is in families.
Dr. Callender, I had to work once um, with a relative, uncle and aunt, and their child was autistic. And there's different levels because I went to study it. Part of my master's was on that. But first, they wanted me to babysit while they had a dinner, which petrified me because I had no knowledge about it because it goes from genius to children that are so poorly developed they cannot even be potty trained. And the behavior goes on the sounds that they make and wandering off and etc., the ones at the lower levels. But after learning it, it can be autistic children. I even had autistic children in high school that were well functioning, but something might send them off, like a piano lab. I had a child. If you hit the vibrations of some particular note, the child would go in frenzy because it is affected their nervous system. But just to work with them and to get to know them, at first it can be very uneasy, but after you work with them, it can. But I now recognize it when I see it. But some parents are in denial and they don't want their child to be labeled as autistic. But most people are now grasping hold as if their child is autistic.
Darryl, you had a comment?
Yeah, reading off the internet says yes, there is a correlation between advanced parental age and an increased risk of having a child with autism. Studies have shown that both older mothers and fathers are more likely to have children with autism compared to younger parents. The risk tends to increase as parents get older, particularly after the age of 35 for mothers and 40 for fathers, according to the Autism Research Organizations.
Any other comments about this unique development disorder that is associated with uh, all kinds of extremes, from genius to less than genius? The one thing is clear that one autistic child is one autistic child, and they all uh, can be different from, as Carol had mentioned, from the genius level to uh, far below. So the only thing we know is that there's no evidence that it is related to vaccines. But although we have heard that from a number of sources, there's no data that suggests that that is the case. Any other comments about this? If not, we'll go to the next article. This is another story of something that we become familiar with, and that is that suicide in those who are depressed manifests itself in many ways. This talks about a particular person who was smiling and talking about projects that he's going to complete, and the next day he took his life. So, because somebody's smiling on the outside does not mean that they're smiling on the inside. And so, uh, how do you deal with that kind of depression that results in somebody killing themselves when you thought they were in great shape? And I guess the only thing that comes out of this is that whenever somebody mentions that they are thinking about it, that we should be as helpful as possible in terms of getting them the help that they need. We know about the suicide line that has been I think over 1 million people have interacted with the new suicide line. But the fact that it's hard to read and understand when somebody is depressed to the point of being suicidal. Darryl, you had a comment?
Yeah, Smokey Robinson wrote a song called Tears of a Clown, which seems to describe it. And then there's a comedian, Robin Williams. Very, very funny guy, had the smile, but then he committed suicide.
Yeah. Yeah, this is one of the most perplexing illnesses, and you think you know people, and you find out that they've committed suicide. And how do you prevent it? That's the question. I'm not sure we know. Uh, but there's so much silence around it that people are suggesting that it's important to uh, have loved ones who are depressed to get them treated and try to support them as much as possible. And that a social environment can be helpful. Any other comments? I think uh, John Buchanan talks about his student who committed suicide. And I'm sure all of us have had some association with people who we never thought would kill themselves, who actually kill themselves. Any other comment on this evidence, this depressing recognition that uh, people smile on the outside but are hurting on the inside?
Dr. Callender, just food for thought. You said you thought knew this person. Um, they're saying that, oh, I know you or something like that, but we really don't know anyone. We think we might know them, what they might do, but we barely know ourselves. So for us to just take for granted, oh, I know he wouldn't do this. You really can't say that statement unless someone else think you can support that statement. I know so and so. I don't think we know anybody really.
Any other comments on this subject, which will be the last paper we discussed today? Any other comment on this?
it could also be delayed reaction to mental trauma, or they saw something that really disturbed them way back when, and they just sort of wiped it off, but then something triggered it later on. That happened to um, my god my goddaughter's brother, who suppressed some feelings he had, and his mother came home, found him hanging from the rafter in the basement.
Mm.
I tell you, you never know what some people can camouflage their feelings. Me, yeah, people can read me like a book, a movie, really.
Can we have another slide so we can go out on a happier note?
Yeah.
Oh, okay. I don't know what the next article is, so let's see. Uh, walking in diet boosts cognition in at-risk adults, something we are well aware of. That so we can go out on that note. But particularly in those people who are at risk for uh, Alzheimer's. So the good news is that walking and exercise is beneficial. And this study demonstrates that it helped 50% of the people. So we can go out on that note, Dow.
Thank you.
Okay. All right.
I'm
Uh,
walking.
what's that, Lucille? You're walking, huh?
I'm walking.
Okay.
So that makes me feel real good.
Okay.
Uh,
All right.
Here's something that could help people that are so depressed about what's going on in our country right now. I don't want you to get suicidal. I just want you to consider moving somewhere else because they really don't like you here. And so they might like you better somewhere else.